All right, thanks so much. About 1 in 10 Americans will be affected by a kidney stone in their lifetime. Diet and lifestyle changes have impacted the number of people who are suffering from these, but the good news, there are options and treatments. Live to tell us all about this is Dr. Christine Lau, urologist with Hartford Healthcare's Tallwood Urology and Kidney Institute. Welcome.
Hey, good afternoon. Thanks for having me today.
You bet. All right, tell us about kidney stones. Are there different types and what causes them? I've had them.
Yes, so kidney stones, everyone probably has, a friend or someone they know who has had a kidney stone, and they can be very, very painful. There are a few different types of kidney stones. And depending on what they are, there are different causes, but certainly there's a lot of diet involved. The things I tell patients before we know what kind of kidney stone they have is that drinking lots of water is great for all types of kidney stones. You flush it out, you prevent the kidney, electrolytes from even getting a chance to create a stone, and also a low sodium diet. These are the two major things that I talk about because sodium kind of increases the risk of everything. So decreasing it helps with kidney stones, helps with heart disease, helps with blood pressure. Yeah.
All right, kidney stones, can they be prevented? We talk about drink a lot of water and get off the salt.
So certain stones, depending on what they are, there are some tweaks that we can do to the diet more specific than the two that we talked about. And there are certainly ways that we can use medications to help prevent kidney stones from forming in the future as well.
What are those medications?
Something like a thiazide, so that changes the calcium chemistry, or potassium citrate changes the pH balance in your body.
All right, what are the latest treatments for these?
So let's say you have a kidney stone and it's already there and you can't pass it. We have some very powerful lasers now and some very minimally invasive techniques. The main kidney surgery that I do involves no incisions. I use these thin, flexible cameras, and you can go home the same day. The procedure are usually under an hour. So lots of advancements in this field.
That's great to hear. All right, and you've got a series coming up about this. Tell me about that.
I do. So Thursday night, this is a series with Hartford Healthcare. I will be going into a little bit more detail about types of kidney stones, what to watch out for when you feel like you have a kidney stone, and what the treatment options are. I'll talk a little bit more about the medications as well as surgeries.
All right, Dr. Liao, thank you so much for being here, giving this great information.
Thank you. Have a good one.
You too.